welcome to InjuryGuru.com. I'm Carla Schimmelfin, a registered physical therapist, and this is the first video in the knee exercise program number 2. So if you are viewing this video, then that means that you have probably completed the exercise program number 1, and I just want to say I'm really happy for you for sticking with it and getting through that program. And hopefully you're finding that you're having less knee pain, your balance is better, your strength is better, and you can start to do some of those things that you've been having trouble with. So if that's the case, I'm really happy for you. I wish there was one magical exercise that I could show you that would take care of all your knee pain, but that just isn't the case. What I have seen, though, over my last 25 years of working with patients is that if you do some good, specific exercises and stretches, you can have an effect on the knee pain and from arthritis or an injury that you've been having. So just stick with me with this program. Some of the exercises are going to be the same, and then I'm also going to show you some new exercises for this program because we're just advancing you through a phase. And I need you to get through this entire phase to ensure that we're getting everything you need for that knee to get you back to doing all those things that you want to do. Make sure that you are still doing that leg hanging exercise on your stomach if you still cannot straighten that painful knee out all the way. It's really, really important that you get that knee straight. It's really important for the function of that knee and as well as for all the exercises that you're going to be doing. So make sure you're still doing that stretch if you need it. Also, don't forget about the patellar mobilization or just moving that kneecap around. If you feel like there's still some tightness there, make sure you're still doing those stretches or that exercise as well. All right, I'm going to show you 2 exercises that are very familiar to you from the first exercise program, and that's the straight leg raise and hip abduction, or just laying on your back and raising a straight leg up toward the ceiling, and laying on your side, raising a straight leg up toward the ceiling. You can add some cuff weights, ankle weights that you can get at the store if you have some or if you're willing to go and purchase some. You can add those for this exercise program, this phase. If you don't worry about it. I still want you to just keep up with these exercises. Good news is for this program, you only have to do the exercises once or twice a day now. Remember before I said I needed you to do them 3 to 4 times a day because that knee really needed the repetition and that was really good for the knee muscles and the knee joint. At this point, if your pain is better and you can do more things, then once or twice a day, I still need you to get this program in. So let me show you the straight leg raise and hip abduction. All right, if you'll remember for the straight leg raise, I want you laying back on your elbows like this or laying flat, whichever is more comfortable for you. You're going to bend your good leg at the knee, put your foot flat on the floor or the bed or the couch, whichever surface you're doing this exercise on. When you go to lift your involved leg, you want to tighten it first. So tighten, lift, and lower. All right, so tighten, lift, and lower. Make sure when you lower that, it's nice and controlled. I don't want you to drop that leg down at all. It's got to be nice and controlled all the way up and all the way down. Again, tighten, lift, and lower. When you tighten that quad up, you should see and feel the quadricep or the muscle on top of your thigh tighten. And to do that, you want to just straighten the knee out or push the back of the knee toward the table. So tighten, lift, and lower. All right, the other exercise is just laying on your side. You can rest on your elbow like I am or lay all the way flat. You're laying on your good side. Your painful side, your involved side, that leg stays straight, and you're just raising it up toward the ceiling. Again, nice and controlled all the way up and all the way down. And that's what that looks like. So 3 sets of 12 to 15 repetitions, and I want you to do this at least once a day, but twice a day if you can get it in.